Welcome to the Gerontological Society of America's Momentum discussion, where we explore groundbreaking topics in the field of aging.
Welcome to this GSA Momentum discussion podcast titled Advocating for Science-Based Person-Centered Obesity Care, a conversation with Ted Kyle. GSA thanks Novo Nordisk for their support of today's podcast. My name is Jen Pettis, and I'm the Director of Strategic Alliances at the Gerontological Society of America, or GSA, and I'm pleased to serve as a host for today's Momentum discussion. I'm delighted to be joined today by Ted Kyle. Ted has been working in obesity policy and innovation for more than 2 decades. He founded ConscienHealth in 2009. As a pharmacist and innovation professional, he works with health and obesity experts for better care and prevention. Ted is active in the Obesity Action Coalition, serving on the National Board of Directors for 12 years and as its chair. He advises the Obesity Society on advocacy and consults with organizations to help address the needs of people living with obesity. As a tireless advocate, he publishes a widely read daily commentary at ConscienHealth.org/news, which reaches a diverse audience of thought leaders in health and obesity. And his peer-reviewed publications relate to obesity, weight bias, and health policy. And I must admit, I read that news, that blog, every single morning. And at this time, I'd also like to thank our colleagues at Obesity Action Coalition, or OAC, for recommending Ted as a guest for this podcast. OAC is a more than 85,000 member strong nonprofit organization dedicated to serving the needs of every individual affected by obesity. And again, Ted is a super active member in that organization. So welcome, Ted. I'm so glad you could join me.
Thank you so much for having me. I can't think of a better way to spend my time this afternoon.
Thank you so much. I understand, Ted, that in addition to your decades of working in obesity care, obesity is a personal topic for you. Can you share a bit with our listeners about your personal journey with obesity?
Just about every member of my family, including myself, has been affected in one way or another by obesity and its effects on health. I have had loved ones die from complications of obesity, and this is not a dramatic thing. It is just something that happens when you are susceptible to this condition, and it progresses and causes other complications. I myself have been seeking care for obesity for more than 20 years. And in the last really few years, I have progressed onto Medicare, which, as you would know, really makes it difficult to access obesity care because the benefits around obesity care were designed at a time when people were not really taking obesity seriously, when there were not a lot of good treatments for obesity. And it really puts treatments that we know are powerful for improving a person's health out of reach. I do the best I can, and I've managed, I think, to avoid some complications of obesity. And yet, I have real concerns that I can't really fully meet with the options that are available to me. Yes, this is very personal.
Ted, just a follow-up to that. People with Medicare can't access the obesity management medications, but aren't there other services around obesity care that they also can't access around therapy and things like that? Can you speak to that a little?
In general, coverage of comprehensive care for obesity, the benefits for that are very poorly covered. To get coverage of intensive behavioral therapy is difficult at a level of intensity that actually has an effect. Medicare did a demonstration project that showed that intensive behavioral therapy for obesity makes a real difference and actually saves money. And yet, last time I looked, it was not much more than 1% of the people who could benefit from it that got it. And that's because of the way the benefit is structured. People don't really take it seriously in designing the plans that people have under Medicare for addressing obesity.
Thanks for the additional information. So often, I think we see obesity seen as this lifestyle problem. If we just ate less and moved more, people would achieve a healthy weight. It's that simple, but it's really not. So how does this false belief impact people living with obesity, perhaps healthcare providers and policymakers?
Forever, it has been assumed that obesity is just a lifestyle problem. And as time has gone by, we've come to understand that, oh, in fact, it's a biological problem. People who are susceptible biologically, genetically, really have the table set for them to develop obesity. It is the environment that triggers it, the environment that we all live in it in. Some people are more susceptible to the triggers in that environment than others. And then people have the choice of what do they want to do about it. But just like environment can trigger cancer or other chronic diseases, when our environment triggers obesity in a susceptible individual, it's really absurd to say, just go lose some weight and you'll be fine. But that is the advice that people have gotten for years. And that kind of thinking puts people in a position of thinking there's something wrong with my character. Somehow I'm not working hard at this. I'm not good enough to overcome this, and I ought to be. And that creates something that we call self-stigma that gets in the way of overcoming a condition. Imagine if we stigmatize people with cancer as if it were their fault. It really doesn't help people achieve good health.
So, Ted, what messages do you have for people who are living with obesity around this idea that, sorry, eat less, moved more, you'd be fine? What messages do we want to share with people who live with obesity about exactly what you said, that it's not their character flaw, it's whatever? What messages do we have for those folks?
It's really simple. We've learned enough about obesity to know that it is just like any other chronic conditions, just like any other chronic condition. Everybody can point to something that they did that might have an effect on their health. And that kind of rumination just really doesn't do anything for you. The question becomes, what can I do about it? And in the case of obesity, as with other chronic conditions, what you can do about it is seek competent medical help. Now, in the case of obesity, that's not all that easy because there are a lot of doctors out there that really don't have the time or the insight to really deal with the obesity as a chronic disease. So it takes some effort to find somebody who will work with you to actually deal with that disease. I have to tell you, I was with a doctor for many years who really didn't understand it at all. I knew more about obesity than he did. I moved on to another one that had a moderate level of understanding. And then I finally, in the last 3 years, got a primary care physician who is studying to take the American Board of Obesity Medicine exam. And she and I have great conversations, and we have a collaborative relationship that is really centered on my health and my needs for coping with my susceptibility to obesity. Makes all the difference in the world.
So, this provider that you've found, this wonderful provider, what message do you have though for the providers who are perhaps holding on beliefs about the false beliefs, outdated paradigms around obesity? How do you help change their mind? Where do you lead them?
For those providers, I would say first, study up, increase your medical knowledge of obesity because that will make you a more competent and more competitive, more attractive provider. You will be benefiting your patient's health and benefiting the quality care that you give. And one way to get a better understanding is to listen to your patients because every provider has patients who are living with obesity. And the best advice I ever heard about dealing with people who are living with obesity is to listen more than you talk. And so I would say it's a real good idea to listen to people who have that lived experience. And there has to be some patience involved because for somebody to really open up about their experience requires a degree of trust. And that trust is not always there right off the top. And then finally, if you're not certain that you can provide good obesity care, and I'm talking about real medical obesity care, don't hesitate to refer someone to a colleague who is board certified in obesity medicine. It's one of the fastest growing specialties. It is an essential specialty. Obesity care does not need to be delivered solely by people with an obesity medicine specialty, but a provider does need to have competence in the special requirements of delivering good obesity care.
So I think you began to allude to this a little bit, but I'd like to focus now on stigma and bias. So individuals with obesity and overweight face so much bias and stigma. And for older adults in particular, they may have been facing this for years, if not decades. How do these issues, stigma and bias, impact people living with obesity?
When you spend a lifetime being told that you are less than because of the body that you inherited, you can be forgiven if you start to believe it. And then the expectations for care that you might get lowered. And even when somebody is strong and thinking they've got that all wrong, then it can cause people to avoid health care, to avoid healthcare systems because those experiences have uniformly tended to be stigmatizing. And the research really shows that this leads to delay in diagnosis of all kinds of conditions. And there's also good research to say that when people start believing what is thought of them because of their body size, then their health outcomes are worse. And there are multiple reasons for that.
What can we do as individuals, and I think particularly in the healthcare arena, what can individuals and organizations do to address stigma and bias? How can we improve the situation?
I think it's really important for people to learn to stand up for themselves. Knowledge is power. And the more they understand about obesity, you mentioned the Obesity Action Coalition. It is all about providing education, elevating the voices of people with obesity, and equipping people to self-advocate and advocate for others. And the end result of that is to expect good care. Might not find it from every provider, but when you have a provider that isn't giving you good care, that isn't giving you good, respectful care, then you need to think about looking elsewhere. And that's a real skill that you have to develop to advocate for yourself, but it makes a big difference.
So I recall in a presentation, one of your presentations, a statement that you made, and it said, good obesity care requires access to the full range of obesity care tools. What do you mean by full range of obesity care tools?
The full range of obesity care tools range from lifestyle support to medical therapy to surgical care. Different people need different elements of that in different amounts, but you need to go into it with the door open to all of those possibilities so that you can work with a provider who understands each of those elements of it enough to get you to the approach that gives you the best possible health that you can attain.
You already mentioned that Medicare doesn't provide coverage that allows older adults to access that full range of obesity tools. So, what would you say to policymakers about the need to offer older adults access to the care they need?
I would really point to the proposed rule from the Center for Medicare and Medicaid Services, CMS, that basically says no, these medicines for obesity that have been excluded forever from Medicare benefits are not simply for weight loss. They are for the treatment of this chronic condition called obesity, and therefore they should be covered. When I say we, advocates in the obesity community have been talking to CMS about this for a decade or more. And we were just absolutely thrilled when folks in CMS said, you know what? Maybe we need to do this. Best idea they ever had.
Terrific. That's will be hopeful, that's for sure, for all of our older adults. Ted, I could talk to you for hours again because I read your blog every day and I love it. What are some final thoughts you want to leave our listeners with?
I guess the most important thing to just take to heart is that whatever the subject is related to obesity, the question to ask yourself is, are we approaching this just as we would any other chronic disease or condition? Or are we approaching it as if it were a behavior? And it hasn't been very many years since one of the major medical organizations classified BMI as a behavior that you could change. Thank goodness they changed that. It's now counted just like blood pressure or blood lipids or any other measure that is a risk factor for poor health and something that you need to manage medically. So keep that in mind. It is not a behavior. Behavior is not irrelevant. You can have behavioral strategies that will improve your situation, but behavioral strategies won't overcome this disease for very many people any more than it cures heart disease or any of a gazillion other conditions that are actually medical conditions.
Again, Ted, thank you so much for joining me. And thanks to those who are listening to this episode of the GSA Momentum Discussion podcast. We hope you found it informative and enjoyable.
Check out GSA Enrich at geron.org/enrich for engaging learning resources, including toolkits, publications, webinars, podcasts, and more.